All right, which of the following prenatal laboratory test values would the nurse consider as significant? What I highly recommend, instead of saying the nurse, you want to put you or say I. Which of the following prenatal laboratory test values would I consider as significant? Because you want to put yourself in place of the nurse. I actually recommend that you have something to write with, something to write on. Not only are you writing your answer, you're writing your rationale, because are you thinking more like a nurse? So that's what you want to be looking at, your critical thinking skills as you take questions. And also too, is this something I need to review in my content study time? Remember, any independent question can be put together in a case study. Right? So it's like grabbing a bunch of questions about prenatal and then throwing it in there as a case study and having you to assess, to intervene, and to educate is typically what case studies do. So take some of that intimidation out of case studies. All right, so would your answer be hematocrit 33.5% or rubella titer less than 1 to 8? That's B. Option C, white blood cell count 8,000. Or D, 1 hour glucose challenge test, 110 grams per deciliter. So here's the thing. Go ahead and pause and then come back. What are we looking at? So we're looking at the relationship. I know it did that real quick. So we're looking at the relationship between prenatal laboratory test value and significant. That is what we're trying to get to, okay? Which one is most significant? Option A, if we look at hematocrit 33.5, there are different ranges we like to see as far as first trimester, second and third, and that still falls within that range. 33.5 is about it. And again, it depends on which lab test reference you look at, but that is not the significant one here, is what I'm saying. Rubella titer 1 to 8. We like to see that greater, less than 1 to 8. We like to see that greater than 1 to 8, because anything less shows that the person does not have antibodies towards rubella. So they didn't get the vaccine or they haven't had it themselves. So we're going to kind of keep that in the option. White blood cell 8,000. We know normally 4 to 11 or 5 to 10, whichever reference you lose. And during pregnancy, it could be anywhere from 5 to roughly about 15 or so. So that's still within normal range. And a 1 hour glucose challenge test, remember, like to do that for gestational diabetes testing, usually around 24 weeks. And like to see that lab value as no gestational diabetes under 140, and that is within range. So what stands out is that rubella titer. And as you know, if the baby gets rubella, or if the mother has it, that pregnancy could end in stillbirth, or the baby could actually have congenital heart disease or other issues, and whatever they have, they typically will live with that. So we do recommend, of course, that people get their vaccinations